If you'd like to stay in this room, we are going to be jumping into our next topic. It is navigating services and an overview from Ontario Health at Home. If you're interested in our healthcare provider topic, that's going to be our other breakout room. That is going to be from our CEO, the Alzheimer Durham region. It's What Denmark Taught Me, Rethinking Community Dementia Care. So if you'd like to switch rooms, if you'd like to stay here, feel free to do what you're comfortable with. But that being said, I'm going to introduce our next guest speaker. Let me get my notes here. So we have Vanessa Bright. Vanessa is a registered nurse with a background both in acute care hospital and community care settings. She joined the Ontario Health at Home team in early 2015, working initially as a community care coordinator and spending several years with the education team before moving into a management role. She has been lucky to work in the Durham region as well as Peterborough and City of Kawartha Lakes geographies and is excited to share information and supports with you today. We will have a little bit of a time at the end for questions. Again, if you do have a questions, please pop into the chat and we'll do our best to try and get to as many as possible. So I'm going to stop sharing, and Vanessa, you are free to take it away.
Good morning, everybody. Thank you so much. It's wonderful to be here today. I am going to get my slides organized, which I could have done before that, which would have been helpful. Give me just a second. All right, there we go.
It looks good on my end, Vanessa.
Perfect. I'll just get everybody back here so I can at least see some faces. All right. So thank you for the lovely introduction, Sarah. Um, I'm Vanessa Bright. I am a manager at Ontario Health at Home. I currently work out of the Peterborough area, but I do live here in Durham region, and that's where the majority of my experience with Ontario Health at Home is as well. Ontario Health at Home, we have gone through many name iterations over the last number of years that I have worked here. We have been the CCAC, we have been the LIN, we have been Home and Community Care Support Services, and we are now Ontario Health at Home. So you may know us by any one of those myriad of names, or we could go back further in history and probably find some others as well. We are still the same organization providing the same services. Again, guided by our mission to help everyone to be healthier at home through accessible, connected, patient-centered care and a vision of providing excellent and exceptional care wherever Ontarians call home. Every day, more than 9,200 Ontario Health at Home employees live our four core values of collaboration, respect, integrity, and excellence. We partner with patients, caregivers, primary care providers, hospitals, long-term care and retirement homes, service providers, and Ontario health teams to deliver responsive, accessible, integrated, and patient-centered care. There we go. If we look at some numbers, a lot of the services that people are aware of that we provide are those home care and in-home services. Every month, every year, Ontario Health at Home services over 651,000 patients. And every month, our care coordinators collectively have over 344,000 active patients on their caseloads across the province. When we look at a lot of the services that are provided in the community, Ontario Health at Home is able to provide over 27,000 nursing visits, 4,200 therapy visits, and over 100,000 PSW service hours every day across the province. We transition over to 28,000 patients into long-term care each year and administer over 1.2 million visits at our nursing clinics annually. So lots of services being provided with assistance of our contracted service providers in the community as well. We're here to help people find their way through our Ontario's healthcare system, understand the options, and connect with community-based care programs. Again, we do work with children and adults, but the primary population that we're working with and that our care coordinators are seeing on a daily basis are our seniors. Our goal is to help our patients remain safely at home with the support for health and care professionals. We can assist with leaving the hospital and returning safely to home. We have care connectors to help find family doctors or nurse practitioners, especially in our more remote areas, assist with the transitions to long-term care homes, avoid unnecessary ED visits, support community service programs, and help patients to die with dignity in the setting of their choice. We offer a range of home and community care services based on individuals' care needs. When we look at how do you access care and supports, anyone can refer another person to Ontario Health at Home. You can call us about yourself or on behalf of a family member, a friend, or a neighbor who may need support. We do have staff available from 8:30 a.m. to 8:30 p.m. to assist with care. When you call, a member of our healthcare team will start by asking a few questions to better understand how we can provide help and supports. You will then be referred to a care coordinator who will complete an assessment, and that may take a number of days before you receive that call back from the care coordinator, depending on what those care needs are identified to be. Our care coordinators are regulated healthcare professionals. They are by majority nurses. We also have physiotherapists, occupational therapists, and social workers who have additional specialized training in coordinating care across our healthcare system. Our care coordinators visit patients in the home, in the hospital, or sometimes in their schools. They're looking to evaluate patients' care needs and develop customized care plans and coordinate services to ensure the most appropriate levels of care to assist with rehabilitation and maintain independence. Again, our care coordinators are looking to understand every patient's situation and to help them make informed choices about their care, to work to co-create care plans, to receive services when and where they're needed, and support the care journey, working hand in hand with our patients and their caregivers and partners. When we look at eligibility for home care or in-home services, some of the criteria that we're looking at are patients need to have a valid OHIP card. They need to have healthcare needs that can't be met on an outpatient basis, the need for at least one professional service or personal support services, and a medical condition that can be safely treated either at home or in one of our nursing clinic settings. If we look at some of the home care services that are provided, which is often where people start their journey with us at Ontario Health at Home, we have care coordination services to help navigate the healthcare system and plan for care and for the future. There are nursing supports offered both in-home or in the clinic setting to help support needs such as wound care, IV management and medications, or health teaching surrounding new diagnoses. We have personal support or PSW services that are put in place primarily to assist with activities of daily living like personal hygiene, bathing, and dressing. We can look at accessing physiotherapy, occupational therapy, speech language therapy, social work, and dietitian supports for patients that are homebound and unable to access these services in the community. Beyond those direct home and community care services that are offered through Ontario Health at Home, our team of care coordinators also manage assessments and eligibility for other care and services, including things like adult day programs, assisted living supports, residential hospice services, and long-term care homes. So often our care coordinators can be the pathway for referral to those programs as well. Additionally, our care coordinators may be able to assist with referrals to other community-based support services that are either privately or publicly funded programs. Our information and referrals team can help connect people with various community supports like housekeeping, meal delivery services, friendly visiting, yard work, snow removal. That's going to be especially important today for lots of us as we look outside. I'm very glad that this is a virtual conference today and that we're all safe and sound in our home environments as opposed to having to drive out there today. We do have care coordinators embedded in our hospital settings as well that are looking to partner with our hospital staff to assess your healthcare needs, arrange post-hospital care, and answer questions and explain choices to support successful discharges home from the hospital. In the community, our patients are attached to caseloads and they're followed regularly by our care coordinators who complete routine reassessments at regular intervals. So you would always have access to reach out to a care coordinator. When there are changes in status, our care coordinators can help guide patients and families through their next steps. And I know that that can be especially important as you work through the dementia journey with your loved ones. Often there's lots of unexpected things that come up, or changes in status can come on quickly and in different ways than we're expected as well. When a patient's care needs start to exceed what can normally be provided through our traditional care services and families are struggling, your care coordinator may review additional options. Some of the programs that are available in the community that are sort of beyond our traditional home care supports that you may have heard of are things like our high intensity supports at home program. Again, this program aims to help system flow and keep our most vulnerable and complex patients safe at home while they wait for long-term care placement. It's an integrated team approach with multiple services to support patients and their families and caregivers. Again, with the goal of bridging that placement and avoiding those admissions to hospital when care needs get high in the community. You may also have heard of our family managed home care program. When traditional care delivery models have been tried and they're not able to meet care needs. So sometimes situations like complex care needs of a patient that require special training, unique scheduling needs, language or communication challenges, remote locations or rural areas where it's challenging to get our service providers secured to provide the care, family managed home care can be explored. This program provides eligible patients or their substitute decision makers with funding to purchase services independently. Patients or their substitute decision maker would manage the responsibilities such as coordinating care and scheduling, hiring care providers, and managing all of the reporting requirements. So there are some options when our traditional care just isn't enough to support patients safely at home, especially if we're looking at a bridge to long-term care. Again, when we look at that further progression and living independently is no longer possible, our care coordinators can help in that journey and help explain other options that may be available, like supportive living or supportive housing, assisted living, or retirement homes. They can discuss options surrounding long-term care and assist with that application. And they can also help with accessing home care and community support services to help manage until a patient can be moved into a more supportive housing location. Our care coordinators get a lot of questions about long-term care, and it can be a complicated process to understand as well. And there's a lot of nuances there. When we look at long-term care homes, we hear a lot about retirement homes and long-term care homes. Generally, long-term care homes are able to provide a higher level of care. There's also some differences in funding, whereas retirement homes are privately run and privately funded. Your costs are going to vary significantly between retirement homes and long-term care homes. When we look at the care that's available and provided in long-term care, services like accommodation, meals, laundry, housekeeping, help with activities of daily living and personal care, nursing and therapy are available in the long-term care homes, as well as medication administration. Every long-term care home has a physician on call that's available to them, as well as 24-hour supervision and social and recreational programs. When we look at long-term care, I know this can be a hot button topic across Ontario and with wait times. Currently, I believe it's 624 long-term care homes across the province. The Ministry of Long-Term Care manages these homes. They are well aware of the bed shortage we are facing to manage our aging population that is requiring long-term care. There are numerous long-term care homes in the process of being built. There are a significant number even here within the Durham region that are at various stages of build with hopes to open in the coming months and years, um, looking at trying to increase the number of beds that are available. Again, long-term care homes are governed by legislated standards. There's a lot of information available online. There are long-term care home finders as well as inspection reports available through the Ministry of Long-Term Care about any of the homes. So if you're looking to seek information about long-term care homes when applying for either yourself or a loved one, there's a lot of information available. Or you can certainly contact Ontario Health at Home at 310-2222 to speak to a care coordinator for further information as well. When we look at funding a little bit, funding for long-term care homes are funded by the Ministry of Long-Term Care, which means that part of the cost of long-term care is subsidized by the Ministry of Long-Term Care. So they pay for the care that is received by residents. There's a co-payment that covers the accommodation cost that falls to the patient or their family member. So the Ministry of Long-Term Care sets the accommodation rates or the co-payment fees for basic, semi-private, and private rooms, and those rates are the same across the province for the accommodation type. There are rate reductions available. Again, we know that a lot of our seniors are on fixed income, and we want to make sure that we're not denying anybody access to long-term care simply based on income. Ontario Health at Home does manage the application and admission process for long-term care as opposed to for retirement homes. So if you're looking at applying for long-term care for a loved one, a care coordinator will help to guide you through discussing long-term care, assessing healthcare needs to determine eligibility, and supporting the application and admission process to long-term care. The application and assessment process is fairly involved. The care coordinators will complete a pretty comprehensive assessment of the applicant, including physical and mental health, functional and cognitive capacity, medical treatment and healthcare requirements, personal care requirements, an assessment of any behaviors. There's a health assessment that is completed by the applicant's primary care provider, as well as any other assessments that may support the application process. All of this is in an effort to provide the long-term care home as much information as possible to ensure that they can provide adequate care to your loved one and that they have all the information they need to develop a care plan fairly quickly. One of the questions that comes up very often when we're looking at long-term care and at that application process surrounds capacity and surrounds who makes the decision about applying for and admissions to long-term care, especially when those applications are coming in for a person with dementia. And this piece can be really challenging for care coordinators as well as for family members to understand the capacity piece. As part of the legislative requirements for long-term care applications, care coordinators need to determine who's the most appropriate decision maker, which means they need to assess the decision-making capacity of the patient specifically related to long-term care home admission decisions. This can be challenging when we know you're dealing with a loved one with dementia who likely has cognitive impairment. A diagnosis of dementia alone does not mean that somebody is not able to make their decision about long-term care home admission. Because we have a power of attorney for personal care in place does not necessarily mean someone is not still able to make a decision about admissions to long-term care. The Healthcare Consent Act tells us that people are presumed to be capable of decision making unless there's reasonable grounds to determine that they might not be capable. So our care coordinators have to go on that presumption of capacity unless they're provided information that makes them question whether that person may really be capable. Those reasonable grounds may be things like memory changes or impairment, questionable judgment or decision making that they hear about during their assessment from either the patient that they've observed or from you as the family members. Um, Behaviors, all of those things may be reasonable grounds to question capacity. In those cases, our care coordinators would then need to evaluate that decision-making capacity. When we're looking at whether someone is capable of making that decision about long-term care, a capable patient has the ability to understand the information that's relevant to making that specific decision about whether to live in a long-term care home and understand the potential consequences of making that decision. So again, our care coordinators aren't evaluating overall capacity or capacity for healthcare decisions. They're looking specifically at, does that person have the ability to understand the information they need to know to make a decision about moving to long-term care? And are they able to understand what the consequences of that choice would be? If it's deemed that the applicant is not capable, then we're going to look to that substitute decision maker or the power of attorney to make those decisions and go through that application for long-term care process. That was a lot of information, and I know sometimes I speak quickly, so I'm sure there will be some questions that come up with that, and I have tried to leave lots of time for questions because I know that's often there's often lots of questions, so I would rather that you had lots of time to ask what you're interested in. So we'll go through a couple more pieces about the long-term care application process, and then I'm happy to get to questions as well. If we're looking at sort of the rest of that long-term care application process, once that comprehensive assessment has been completed and the care coordinator has determined who's the most appropriate person to make the decisions about admission to long-term care or not, um, they will then need to obtain a signed consent form as well as a home choice form. Eligible applicants can select up to 5 choices for long-term care homes anywhere in Ontario. You're not required to select 5 homes, but you may select up to 5 homes. The application is then sent to each of those homes, and they have the ability to review those homes to determine whether they're going to accept the applicant to the wait list or not. Again, reviewing, do they feel they can meet the care needs that are required by that patient? Then we get to the tricky part and the long part that we know is the waiting. Wait times for long-term care vary significantly depending on the home selected, the type of accommodation, and the specific care needs of the patient that's applying. Wait times can vary from months to years. We know that for a lot of our long-term care homes here in Ontario, years means many, many, many years, depending on the home that you're applying for. Again, the Ministry of Long-Term Care is well aware, and they are absolutely working at trying to expand the number of beds that are available, but it is definitely challenging those wait times. Again, if you're applying to long-term care with a family member, I would encourage you to speak with the care coordinator about the wait times for the specific home and accommodation type and care needs that you're applying to, because they'll have much better information to give you as good an estimate as they can, knowing that things can change frequently with wait times for homes as well. If we move to sort of the next step in what does that process look like on the journey from application to moving into long-term care for a loved one, when a bed eventually becomes available, the decision maker will receive a placement offer that includes a specific move-in date. The decision maker then has 24 hours to consider that offer and to make a decision to either accept or decline that bed offer. If the offer is for a bed in one of the long-term care homes on the list that's not your first choice, you have a couple of options. You can accept that bed offer, move into the home, and stay on the wait list for the other homes that are a higher rank on your list, so for your preferred home choices. Or you can decline the offer. Patients always have the right to decline the offer at the time of a bed offer. It is important to recognize, however, if you do decline a long-term care home bed offer, it means that that applicant's name is removed from not only that long-term care home wait list, but the wait list for all long-term care homes to which they've applied. their application would be closed and they would need to wait 12 weeks before reapplying to long-term care unless there was a significant change in status. And that's the legislation from the Ministry of Long-Term Care. So that's a piece that our care coordinators will discuss at the time of making an application, but we want to make sure that patients and their family members are aware of what happens if we do decline a bed offer, although that's always everybody's legal right. Again, I can see there's lots of questions coming in, which is excellent. So I am going to wrap up my sort of slides that I have here, and then we can get to some questions as well. So again, we're here to help and be a partner to help guide you through this journey that you're going through. I know how incredibly challenging it is, having also dealt with a loved one going through the dementia process. So I can appreciate the situation that some of you are working through, although everybody's life experience is very different. Um, like we said, anyone can refer another person to Ontario Health at Home. Although, like with anything, we will need consent from our patient to proceed or from their SDM. You can get in touch with us by calling that 310-2222 number. There's no area code required. And we do have staff available 8:30 to 8:30, 7 days a week. So you can call for that intake on the weekend if that's a time that works better for you. You know, sometimes those 8:30 to 4:30 hours during the week are challenging for people if we're working as well. We also have a significant amount of good information available on our website about a variety of different programs. There are booklets available as well, along with other information about getting started with us. So you can visit ontariohealthathome.ca for that information as well. If you're looking for other community supports and information, I would encourage you also to visit thehealthline.ca for up-to-date accurate information. It is a provincial database. I believe it lists over 50,000 different services in the community. And you can search by geography or by topic or keyword. So there's a lot of good helpful information on there as well about community supports. You can go in if you're looking for in-home foot care. You can do a search for your region and for foot care, and it will give you a list of people who provide in-home foot care as an example. So there is definitely some helpful information there as well. And that is all for my slides. So I'm going to stop sharing my screen here. Um, maybe I am. I can figure out how to stop sharing. Stop share. There we go. I will
Perfect.
stop sharing my screen and then I'm happy to move to some questions.
Wonderful. Thank you, Vanessa. So we do have a couple in the chat. We have some questions. We have some thoughts I think are going to take us perfectly into our lunch break. So excellent that
Perfect.
you said you planned for a lot of time. So the first one that came, it says if we need a companion in the long-term care facility, what is the process? If you maybe want to do a quick overview, because I know you just went to a little bit of detail about it.
Okay, so companion care in long-term care, it depends on what we're looking for, the type of care and the type of additional support in long-term care that you're looking for. Um, my first suggestion always would be to speak directly with the long-term care home to see if it's support that they have available. Again, within long-term care homes, they do have supports available through Behavioral Supports Ontario. So if some of the need for companion is related to some responsive behaviors, they do also have ability to apply for additional funding. So it really depends on what that support is that's required. We do have some ability to do some transitional PSW supports right at that time of initial moving in to long-term care from home, if that's something that's going to be helpful if your loved one has had some PSW supports at home and they have a particular person that's been visiting them regularly and that will help with transitioning their routine. Those are things that we can look at as well. So I know that doesn't fully answer your question, but there's a lot of additional layers there too. And I don't know if some of that was going back to some of Dana's presentation as well.
All right, thank you, Vanessa. So a follow-up question says, does long-term care have to do the process for extra services, or can caregivers ask it directly with you?
Okay, sorry, I'm just looking for, does long-term care have um, have to do the process for extra services. So generally, once a person is admitted to a long-term care home, the majority of the care is then provided through the long-term care home themselves because that's where the funding through the Ministry of Long-Term Care. I know that sounds terrible to bring it back to funding, but the majority of care is provided through the long-term care home. Um, and they do have a lot of supports and services available directly through the home. So that would generally be my first go-to is go through the long-term care home and see what's available. Generally, home care supports aren't able to go into the long-term care homes.
All right, thank you. So there's a couple more thoughts, a little bit of feedback, opinions in the chat. I'm just going to jump into our next question here just for
Yep.
time. So it says, are your services only offered to individuals diagnosed with dementia, or you offer it for people who have difficulties to move around in their homes?
Absolutely. So Ontario Health at Home supports are available to anybody requiring any of those services, regardless of diagnosis and regardless of age. So if there's somebody that's requiring those in-home supports due to any diagnosis or challenges managing their daily care and activities at home, then yes, a referral can certainly be made.
Thank you. Oh, go ahead if you have
And
anything.
I agree that the wait list for long-term care is very long, especially depending on the home and the accommodation type. It's incredibly challenging.
All right, thank you, Vanessa. I'm just going to jump into our next one down here. It says, for the decision making, what if the individual understands, but they don't see the gravity of their situation, refuse to go to long-term care? What can a caregiver do at that time?
And that's a really challenging question. And part of the determination of capacity is not only understanding the information, so it involves things like understanding their current care needs, understanding the amount of support they're currently getting, understanding the care that could be provided in long-term care, understanding the risks to the situation that they're currently in, and appreciating how those things could affect them. If they do all those things and are continuing to make the choices, it can be very challenging when people are making unsafe decisions, but it's whether they understand that they're making an unsafe decision or not. So we're looking at, and somebody said it well once, we're not necessarily looking for a reasonable decision. We're looking for a reasoned decision because people make bad decisions all the time. So we need to determine, are we making a bad decision because we're making a bad decision, knowing what could potentially happen? And we're choosing because sometimes if we were a stubborn adult at 40, we're still going to be a really stubborn adult at 85 with dementia. Um, or are we making this decision because we don't appreciate what could happen? We don't appreciate that it's not what could happen to us if we walk outside on a day like today wearing sandals and a t-shirt. That's very different, and that impacts that capacity piece of that understanding and appreciating the consequences of the decisions. So my suggestion would be if you feel that you have a person who's in that situation where they don't appreciate the risks or how those risks apply to them, I would encourage you to reach out to the care coordinator to request that that capacity is reevaluated. Challenging pieces for our care coordinators or for anyone to take away an individual's right to make the decision about where they want to live. They need to have really clear and compelling evidence that that person is not able to understand that information that's relevant. While that can be really challenging, I also appreciate that as a human being because I wouldn't want someone to take away my right to choose where I was going to live unless they were really sure that I couldn't make that decision safely.
Thank you, Vanessa. All right, we have a couple more. Uh, so this one says, how can we know more about these supports? The behavioral therapist and long-term gave great tips for staff, but now we need extra help. I'm just going to confirm for the individual who asked if you're referring to the Sports Voluntary Health at Home, or if you can give a little bit more detail, or Vanessa, if you have an answer for that.
Yeah, and that's what it looks like it looks like the rest of the question was the behavioral therapist in long-term care gave tips for the staff, but now we need extra help. So I'm thinking that if this person is in a long-term care home, my suggestion again would be to go through the long-term care home to look at requesting those additional supports. You may need to advocate very strongly. Our long-term care homes do have the ability to apply for some additional funding for staffing. It is not always granted, but depending on the levels of supports that are required in terms of care for that loved one, that can be a route to take as well.
Thank you, Vanessa. Not too many left. Next one.
Yeah.
How do we apply to the new long-term care facilities? Is it right to assume that those facilities do not have a list and the applicant might be faster placed there?
Absolutely. So this is an excellent question. As the Ministry of Long-Term Care determines the opening dates for new homes, prior to that, they will determine the date of a waitlist opening for specific homes. Um, there's a lot that goes into the process of building new long-term care homes, and then the approvals that are required before they can open that home to applicants. The most recent one I'm aware of was Station Place in Havelock, and it is definitely a process, generally a number of months before the home is due to open. Once most of the ministry approvals have been received, they will open the wait list. Often, there will be community announcements and awareness. If you have a loved one that is on the long-term care wait list for other homes in that area, and there is a new home opening, generally you are sent information that there is a new facility opening with a choice sheet, or you can certainly let your care coordinator know that you are interested in that home and ask them to contact you when that wait list opens as well. But you're right, there'll be a certain date when the wait list opens, but we don't have the ability to add those homes to choice sheets until the ministry opens the wait list.
All right, last two questions it looks like. Does a referral have to be done by a doctor or is there a self-referral?
Nope, anyone can refer to Ontario Health at Home. So referrals can come from a physician, they can come from a hospital, they can come from a patient themselves, or they can come from a family member or a friend. So anyone can call through to that number and make a referral. Absolutely.
All right, and look, oh, go ahead, sorry.
Nope, and I was going to say I'm reading along with you, but you go ahead and read, which is great.
I would say the last one we have is for having a decision maker, does the individual have to have that written before a diagnosis?
So that's a great question, and depends on what type of decision maker. So if we're looking at a power of attorney for personal care, that doesn't necessarily have to be created before diagnosis. Generally, a power of attorney for personal care would be done through a lawyer, although there are some DIY, do it at home kits for determining a power of attorney. Legally, somebody needs to understand um, what they are assigning. So if a lawyer will assess whether somebody is able to determine a power of attorney. If somebody doesn't ever have a power of attorney, because lots of people don't, they never did the documentation, there is a substitute decision maker hierarchy that is through the Healthcare Consent Act that would be followed, that would determine who was the most appropriate decision maker or the next decision maker if there wasn't a legal document like a power of attorney. So it would go to if they had a living spouse. If they didn't have a living spouse, it then becomes their children who become equally ranked decision makers, and there's a hierarchy that moves down from there as well.
Thank you. All right, looks we got one more and it says, can we put our names in the waiting list since the waiting is long?
And is that a can we, as in you and I, put our names on the waiting list since it's long? Um, in order to apply for long-term care, patients do have to be eligible, which means they need to have care needs that need to be met in the long-term care home. And I saw the yes there. So, and I agree, the lists are long enough. I remember as a care coordinator assessing a couple that were in their late 90s, and we were discussing the wait times, and this is probably 8 or 9 years ago. And the homes that they were interested in had wait times of about 8 years. And this lovely man who was 97 could barely catch his breath because he couldn't stop laughing at telling me that he was going to be dead long before then. So why was he starting this application? But In order to apply for long-term care, we do need to have care needs. So you need to have the need for either supervision or assistance with personal care throughout the day, the need for nursing supports throughout the day, care needs that can't be met in the community safely. Otherwise, can you imagine what the wait lists would be like if we all put our names on them? They would be atrocious.
All right, it looks like that was the end of our questions. So thank you so much, Vanessa, for asking them. Thank you to our attendees for asking some wonderful questions. We love your participation. And that being said, we are going to break there and we're going to pause for lunch.